5 years ago, the UN General Assembly designated September 29th as the International Day of Awareness of Food Loss and Waste. It's a date not lost on a recent Marquette University graduate whose service-minded approach is helping to improve the outcomes of people who don't have enough food. Daniela Cotto puts this food waste warrior in our Sunday morning spotlight.
I loved reading about nutrition as a kid. My mom had this Disney book, and the food pyramid had like broccoli, cheese, and eggs, which those were things in my house, but that wasn't what I ate for dinner.
Priya Huja recalls first learning about food and nutrition at a very young age.
The food pyramid often preaches standards based on an American nutrition education standard, and I think it's important to include different cultural examples of that.
She was born in New Delhi and moved to Brookfield with her parents as a baby.
I think my parents always set a really strong example about eating what we had and thinking about how fortunate we were.
Wanting to spread those values instilled in her, Ahuja started her journey in high school when she worked to collaborate with local restaurants to combat food waste.
My sophomore year of high school, I proposed a program called Plate for a scholarship to reduce food waste from restaurants to help people who didn't have food get leftover food from restaurants.
But then the pandemic hit. The idea stayed with her, but it wasn't until she moved to Milwaukee for college that certain stark lifestyle differences began to change her outlook on life.
Milwaukee looked so much different than where I grew up.
She began to learn how access to food can shape health outcomes.
Looking at the placement of grocery stores and access to healthy food, the price of food, that definitely struck me as something that needed to be fixed in Milwaukee, especially when it came to communities of color who were disproportionately affected by that.
Learning about nutrition and food waste became a passion Ahuja had to share with others.
We live in a community that you're so separated by your socioeconomic status that you don't realize how limited of a resource food is until you don't have it.
As part of an honors project during her sophomore year in college, she proposed an education program where she'd spend hours teaching elementary kids about nutrition.
Having those early relationships that are positive towards food and eating, it shapes long-term habits.
It developed over the course of 2 years.
Which was supposed to end when I graduated, but I really wanted to do it again.
And it's now become an optional long-term program sophomores can take with Milwaukee Academy of the Sciences at Marquette University.
Not thinking of it as a third world thing, but actually as a very local, pressing issue might help us rethink wasting food and how much we buy.
Health experts say the world wastes about 2.5 billion tons of food every year. The U.S. discards more than any other country. We're talking more than 40 million tons. Ahuja has been an advocacy volunteer with 16th Street Clinic and most recently a Spanish translator at City on a Hill, a nonprofit that serves uninsured and medically underserved residents in Milwaukee.
It takes just one more person to help set you up for a better future.
Ahuja says there's a lot about health that goes beyond the context of a clinic or a hospital.
Thinking about if they have access to food, access to transport, do they have a stable job and income? Do they have mold in their house? Do they have issues within their family that they're not able to talk to someone about?
She recently graduated from Marquette University with a degree in biomedical sciences and a minor in Spanish for health professionals. Her goal? Connecting with those who might just need healthcare services the most.
Hola, para su cita hoy necesito. It really means advocating for a patient population who may not have access or they may not know the country as well as other people might. With patients in America, diet and exercise are just two words that get brushed over, but if a physician or a provider can really connect with their patient's background, understand their culture, and say, okay, here are some dietary recommendations, how can I fit this into what your culture already has? And that's exactly what I want to do as a doctor.